Okay, welcome back to Zaid Ibrahim podcast. This is the second segment of the conversation we're having with Professor Amer. And Prof, you said just now that there are various ailments and we should be concerned when it affects our function. Okay, now, for example, mood. No, everybody has moods. When should we be taking steps to get to see people like yourself or whatever? At what stage? Or depression, for example. It's common for people to be depressed. I mean, sometimes you have something happening in your family or something that happens to yourself or your financial condition is not so great. And you have some depression symptoms. And of course, we're not looking at the more serious issues. But these are serious enough. So I just want to know, at what stage do we then say, I think I need treatment?
Yeah, I love this question because I think it really puts across for us to distinguish between what is normal and what when it becomes abnormal.
Yes.
And as you rightly mentioned, all of us have emotions. We want you to recognize these emotions. And one of the emotions that we've been given is going to be the emotion of feeling sad. Now, the difference between depression and sadness or normal depression or depressed mood, as we often call it, versus depression, the illness, is going to be a few things. And one, it's going to be the duration of that condition. So individuals that are struggling with depressed mood, often the duration is going to be short. The second one is going to be the consistency of that particular mood situation. So individuals that have depressed mood, often, sometimes they would be able still to pick up in their mood due to certain circumstances. Individuals that are struggling with the mental health issue of depression, the illness itself, will often be pervasively, persistently in that depressed mood for most times of the day, most days of the week, most weeks of the month. So it's something that is there consistently over time. The second one is going to be in terms of the ability, the variability, in terms of you're able to be picked up. So individuals that have depressed mode, a friend comes along and maybe tries to cheer him or her up, they might be able to be cheered for a short period of time, depending on the circumstances that they are, even for those who are maybe grieving, for example. But individuals who are struggling with depression, they often are unable to have that improvement. In fact, what happens is that they have almost a negative mindset. I call depression, the illness, an end-all and be-all. Because when we are trying to cheer him or her up, they will then look into that very positive situation to be negative towards them. Because it's pervasive in all respects. And often depressed mood is going to be very variable also depending on the situation. Right? You might have situation A that you're feeling down because your girlfriend left you maybe. But then often at this situation B, you're okay. But depression, the illness, it doesn't matter whether you're working as an employer, whether you are functioning at home as a member of a family, whether you are with your friends, you're going to be persistently depressed during that period of time. Now, the other one that's often talked about, as we mentioned just now, is going to be functionality. Individuals that often have problems with depressed mode still can function to a certain level. Those with depression, often you'll see the functioning becoming less and less, and they'll have deteriorating in functioning. In fact, it not only gets less and less, it gets worse. And then for some of those at risk, you might also have, for example, thoughts of not being with us, dying, for example, which most times doesn't happen with individuals that are struggling with a normal emotion. They might have fleeting thoughts, but often it doesn't stick. Whereas for depression, the illness itself, after a long period of time, having the symptoms that we shared with you just now, that they often will then start thinking about it, and they might actually sadly even act on it. And that's, I think, where the difference between the two is. So these are some of the differences that we often see. But like I said also before we are going to give that label of depression, the mental illness, we have to make sure that we have ruled out other physical illness. Because depression, it can be just a symptom. And you can still have some level of functional loss with the symptoms just now. The question is what is the true cause of that mental illness depression. So one of the definitions when we talk about diagnosing anybody with any mental illness is that there cannot be another physical illness explanation. There shouldn't be an explanation that it is caused by some level of drug abuse, for example, which can also happen. It needs to be on its own in that sense. And often once you have that particular individual and you go back into the history, then you'll find maybe some telltale signs that they are at risk towards getting this particular illness. For example, they might have family members that have had this condition even before. And sometimes it runs in a few generations.
Oh, it's genetic.
Parents, there's a genetic risk that's present over there. They might have a long-standing history of trauma in the past, which might be contributing towards the health condition that they have. It's a contribution factor. It doesn't mean that it's caused it. Something else might have happened in between, but they were at risk. Yeah. So these are just some of the other aspects that we look at when we are evaluating an individual with that mental illness called depression.
Okay. Now, how does the family help? I mean, how does the members of the other members of the family or friends?
Yep.
Because sometimes help, sometimes it works, sometimes it makes it worse.
Mm-hmm.
I know it. I don't know whether I've expressed myself well, but are these people, people susceptible to this depression or stress or severe mood problem? Yep. Do they welcome help?
Yep. So I think first of all, you're right in that sense. Like, how can we help ourselves, and how can family help us or those that are struggling with issues in mental health issues, right? Including mental illness, which is in a way the extreme form of it. I think the first thing that we all need to appreciate is there's still a lot of stigma, a lot of misperception, a lot of judgment towards this health condition, which involves mental health capacity or capabilities, right? And as a result, the stigma or this perception or judgment, often we have ideas that might not be based on the science with regards to this. And this is where families can help other family members by being a little bit more educated, like what we're doing right now in this podcast, understanding that there is this particular entity. This entity has been there for quite some time. It is a medical condition which individuals can help, So that's the first part, I think, that needs to be addressed. The second part is there's a myth that individuals that are struggling with a mental health issue, whether it is stress, extreme stress, depression, for example, do not want help. Often studies have shown that they come forward to help. They come actually and ask and just tell, for example, Tuan Zaid, saya rasa murung. It's a matter of you asking the next question, murung macam mana tu? Apa yang berlaku? Or, okey je tu. Memang saya pun rasa murung juga. It depends on how you respond to that. But they've come for help first. And when they could not find the help, or we dismiss them when they're helping, when they want help, then therefore sometimes they feel dejected. And as a result of that, already the depression, as I said, is an end-all and be-all. They feel like they're now alone. Even their best friend doesn't want to help them. Therefore, there's just no point for them to be around, for example. So for us to at least acknowledge that emotion, I think is the first step. And then if you're aware, if they start mentioning other red flags or telltale signs that things are not right, like, I just feel like I don't want to be here anymore. A friend of yours that you've never heard giving up on life suddenly mentions this. Or mentions things that are a little bit strange, like, if I'm not around, Tuan Zaid, maybe you can keep my watches, for example, right? So it's something a bit odd. So just being aware of those telltale signs, and if you're aware of that, then at least you can drive them towards the necessary help.
So we have to have a strong sense of empathy. We have to be understanding of members of the family or friends or colleagues in the office. Like you said, that seems to suggest some problem, deep-seated problem. Yeah, reaching out for help. Yeah. So we should always try to be positive and want to help them. That's what you're saying, right?
Well, at least be aware that individuals might need help. So what we can do is, number one, you can just listen to them. Number two is that you can offer help. as in drive them towards areas for them that they can find that help. I mean, if you wanted to go a bit further, you can bring them to the help. Or if you have the capabilities, the skills, then you can help them. But I think the first one is to not be judgmental. The second one is to listen to their needs, and as you mentioned, be empathetic, try to understand, acknowledge that emotion, and then be able to drive them towards whatever necessary.
Is this okay? I'm sure that the problems of this modern mental illness, that's probably more prevalent in the cities, in the urban areas, or are they also widespread in the rural areas?
I think
do you have figures?
Yeah, well, I think it's often mentioned that the numbers, prevalence-wise, or the rates of these illnesses happening in whether rural or urban, lower, middle, or high-income countries are pretty much the same in general for the various types of mental illnesses that we talked about just now. It's just that probably in terms of awareness, in certain areas might be different. And as a result of that, you might see in the statistics pockets where it looks like there's more of one condition rather than the other in certain areas. But I can't deny the fact that definitely the environment plays a huge role in terms of at least pushing individuals at risk to develop certain mental health issues. One of the biggest risk factors for developing any mental health issue is going to be the role of stress. Yeah, the role of stress. So definitely more individuals that are staying in urban areas with the kind of fast pace that we're living in will be at risk for developing stress at some point of time. Now, the situation where if your condition is persistently under stress, if you happen to be at risk, then you're going to have a higher chance of struggling with your mental health needs. Yeah, and this is not even talking about your physical health needs, because you're not going to be sleeping well, definitely going to be exercising because you're chasing something, and of course you're going to be at risk for other health conditions, which will then increase further the burden that you might have on your emotions and your mental health. So definitely there's going to be a little bit more risk in certain areas of the urban side. But again, we can't overgeneralize because it really depends on your situation in the urban setting too. If you're in a setting whereby you have the access towards help, no matter how stressful situations might be, or the access towards how to handle yourself a bit better, because you're in a place where knowledge is a little bit easier to be found, it could be a protective factor to a certain level. But if you happen to be really stuck, like, not only on the urban side, but you happen to have a poverty issue, your environment that you're staying in is also not the most conducive, you're slightly illiterate because of whatever reason, then definitely I suspect that everything is really going against you for you to be more at risk of developing certain mental illnesses in urban setting.
Would you say that financial condition has a big influence on on making people suffer from this ailment? Would you say that?
Well, definitely financial issues would be putting people at risk for developing stress. Stress.
Yeah.
And as we discussed just now, stress is going to be a major risk factor in developing mental health conditions.
Yes.
And there's also been studies to suggest in the past whereby when countries happen to be in grave financial difficulties, then there's going to be an increased number of individuals in those populations that may be struggling with health conditions, both physical and mental as well. So definitely I would say that there's a contributing factor there. In fact, one of the biggest preventable things that we can do as a country is actually to eradicate poverty.
Yeah.
Because poverty itself is a major risk factor, which I think is modifiable to a certain level in uplifting the health condition of people, Malaysians including, both physical and mental.
Yes. And I also want to ask you about, I'm sure psychiatrists are expensive. I don't know. So if I were to go, is it affordable? That's all I'm saying. If I have a problem, I go to the government hospital.
Yeah. So I think the first thing that is really important for our country is that we are really one of those countries that are quite lucky. Yeah. Lucky. Because we have both public and private services available. And the government in the ministry also equally addresses mental health concerns. In fact, over the last couple of budgets, they've put quite a bit of support in assisting people struggling with mental health issues, both in the community and also in the services as well. So for those of us who are Malaysians that might be struggling with a mental health condition, every government hospital will have a Department of Psychiatry. Yeah, and it is the ministry's, as far as I'm aware, goal and target to put at least a psychiatrist in hospitals across the country. So a number of colleagues have been sent to places that maybe 20 years ago they would not be a psychiatrist. At least one individual. Right?
That's good. Yeah.
Which I think is the service that you should give. But for those of us who might not, want to go through a public system, we have a very interesting open door system whereby you can find psychiatrists that you want to see and you can visit them in private service. And even in private service, their rates would really depend, actually. And I would say that if you're looking at it as an investment in health, then definitely it's not going to be expensive because the rates might be between, 100 to 200 ringgit maybe. For seeing one of these medical practitioners. But in the bigger scheme of things, if you're going to be healthy after seeing them for maybe a couple of times, then the ability for you to earn and function like a normal person, again, would definitely be that investment. Yeah. And not all mental health conditions and mental illnesses require long-term follow-up as well. So therefore, depending on the condition that you might be struggling with, that visit could be just maybe a time or two, but some might need even longer periods of time. Yeah. So this is, I think, where the benefit is. And I think also what's quite important as well in Malaysia is that we have most of the mental health practitioners available. You've got the psychiatrists as the medical doctors that are involved with mental health care. You've got clinical psychologists as well that do a lot of talking therapies. We have counselors available in our country. We have social workers that might help in the social situations. We have occupational therapists as well that might assess in terms of their functioning at work. And we've got trained mental health nurses too. So I think as an ecosystem on the practitioner side, it's actually quite good.
Quite adequate.
And also we must not forget our friends in the non-governmental side as well, where we've got not only non-governmental organizations that are formed by ex-healthcare providers or present healthcare providers, but also from families and patients themselves. Okay. So they're what we call lived experience individuals that push governments and colleagues like myself to improve our service better. So I think personally we have quite a good, robust system. And I think the last point I'd like to put as well is that the technology to assist certain mental illnesses is available in the country. Okay. Yeah. Medications that might be required, even sometimes psychosurgeries that might be required for certain conditions. We have it available in the country, which is not to say the same for some countries that I've visited or consulted with, where they might have a psychiatrist, they don't have the service.
Yeah, the service.
They might have a psychiatrist, they don't have the team. Right? They might have a public system, there's no option for private. So those are the kind of benefits that I see in our country.
Okay, Doc, thank you. We'll take another break. We'll go to the final part in a few minutes. Thank you.